Hello guys, welcome back to my channel The Physiosapien, and in this video we are going to learn about MMT, that is manual muscle testing. So we are going to learn about the definition of MMT, which most of the people go wrong. Okay, so the next is principles of MMT, the grading methods. The two grading methods are MRC scale, that is the Kendall scale, and the Lovett scale. Okay, the next is types of MMT, that is the group MMT and individual MMT, that is IMMT. Next is the uses of MMT, the advantages and disadvantages of MMT, and the most important thing, that is the MMT of each group and individual muscles. So one important thing you need to know before starting with MMT is muscles, the origin, the insertion, the nerve supply and the action, which you learned in your first year. Okay, so basically MMT is applying a resistance, the manual resistance, to a movement which is caused by a muscle. So for example, the elbow flexors, these are the biceps brachii, the brachialis and the brachioradialis. So if you want to do a group MMT, you will do just elbow flexion. Okay, that will do the MMT of elbow flexors. But if you want to target a specific muscle, okay, so you need to know the action of each muscle, in which position is that muscle most acting. Okay, so for example, the same elbow flexors, if you want to target biceps brachii, you will do elbow flexion in supinated forearm. Okay, and in that position the biceps brachii will work the most. Next is if you want to target brachioradialis, so in mid prone position brachioradialis acts the most. And similarly, if you want to target brachialis, so you need to pronate the forearm and then do elbow flexion. In that position the brachialis will act the most. So if you want to do MMT, you need to understand, you need to learn where the origin is, where the insertion is, what nerve supplies the muscle, and what action does the muscle do. So you might wonder, why do you need to know the nerve supply of the muscles? So there are basically two reasons. The first one is to know which nerve is affected, and second is to know what is the level of lesion. Okay, so if any nerve is affected, for example the radial nerve is affected, then it will reduce the strength of all the muscles it supplies, basically the extensor muscles of the arm. And to get to know the level of lesion, so where the lesion is present, the muscles below it are not supplied by that nerve. So all the muscles below that level of lesion are affected. Therefore, you need to know the nerve supply of the muscles. So what is the definition of MMT? MMT is defined as a technique of testing the strength of a skeletal muscle or a group of muscles manually without the help of any external device except for gravity. Okay, the first mistake that people do is they write MMT as a testing of power of a muscle. It is not a test of power of the muscle, it is the test of strength of a muscle, which is done manually using your hands and the assistance of just gravity and no other machines. Okay, so remember this definition accurately, because this is what exactly MMT means. Okay, the testing of strength of a skeletal muscle or a group of muscles without the assistance of any external device except for gravity. So MMT has 6 principles. These are the position, the stabilization, the demonstration, the resistance, the documentation, and the actual test performance. So we will be covering each one of them separately in the next slide. So the first principle of MMT is positioning, which is divided into patient positioning and joint positioning. So what is patient positioning? The patient is positioned according to the plane of movement. So what are the 3 planes of movement? Sagittal plane, frontal plane and the horizontal plane. All the flexion extension movements occur in sagittal plane. The abduction adduction movements occur in coronal plane or the frontal plane. And the internal and external movements occur in the internal and external rotations occur in the horizontal plane. So according to the movement, we position the patient. Next is comfort of the patient is most important. Therefore, do not change the position of the patient frequently. So remember this one line, patient comfort is more important than the accuracy of the testing. Okay, so for example, you are testing the hip muscles. Okay, so when the patient is in supine position, complete testing all the muscles of the patient which are to be tested in supine position, then turn the patient to side lying, then turn the patient to prone, and then back to other side lying, and then again supine. In this way, the patient will feel more comfortable because there is only one rotation and you are not putting the patient again and again supine, then prone, then supine, then again side lying. You are not doing that. That is uncomfortable for the patient. So I have also made a list of the upper limb and lower limb MMTs, in which position you need to test each muscle. So I will be showing you that in the end, which will help you do all the testings of the muscle in each position. Okay, and patient position should be stable. So you are not putting the patient in some unstable position while testing, which will indirectly lead to trick movements. Okay. So next is joint position. The joint is positioned according to the grade of testing and which muscle is to be tested. And the distal end of the joint is always moving because we can apply resistance easily on the distal end of the joint. Therefore, distal end is moving always and the proximal end is stabilized. So the next principle of MMT is stabilization, which plays a major role in preventing the trick movements while performing an MMT. It is done at the proximal end of the part of joint to be tested. Okay, so let's take an example. We want to test the shoulder flexors. Okay, so here we have the humerus, the radius annula, and the hand. Okay, and here we have the scapula. This is the side view. Okay, so you need to stabilize the scapular movement. Okay, so while performing shoulder flexion, this is a normal shoulder flexion, but a patient can also do shoulder flexion as this. Okay, so you need to stabilize the scapula with your hand from the back, and you need to apply resistance on the forearm or the distal end of humerus. Okay, whatever you feel comfortable, apply resistance there. Okay, and ask the patient to do shoulder flexion. So the next principle of MMT is demonstration. So you have asked the patient to move the limb in certain direction. So this is your verbal direction, verbal teaching. Okay, but you need to also teach the patient through visual as well as through proprioception. So you will show the patient how it is done correctly by doing it yourself. That will be the visual teaching. And next, you will do the movement on the patient passively, so that the patient gets to learn through proprioception. Again, both the limbs you have to do. So first you will do the unaffected side and then do the affected side. The fourth principle of MMT is resistance. It can be applied using gravity or manually. It is applied opposite to the direction of pull of muscle, which is a basic common sense. If you are going to apply resistance, it needs to be in the opposite direction of the movement which that muscle causes. Okay, it is applied distally for better leverage. So this concept is related to torque. Okay, so torque is basically force multiplied by radius. Okay, so the distance from the point. So if you apply a resistance close to the joint which is to be moved, so in that case the torque is less. Therefore you need to apply more resistance to reach the same torque. So you need to apply more force to reach the same torque. Okay, but if you apply it distally, then the distance from the joint increases. Therefore you need to apply less force to produce the same torque. Therefore the effort of the therapist is reduced. Therefore distally applied resistance is preferable rather than applying the resistance near to the joint, until and unless it affects the stability of the joint. Okay. Next is it is applied same on both limbs. Okay, you need to compare both the sides while doing an MMT. So you will apply resistance first on the unaffected limb to get an idea of how much resistance he can bear normally, and then apply the resistance on the affected side to compare what is the difference between the resistance of both the sides. And the resistance depends on the age of the individual. The younger individual will have more strength than the older individual and the children. Then gender, men usually have more strength than females. Occupation, a person who has heavy work occupation will have more strength than a person who does office desk job. Okay. Next is training. A well-trained individual will have more strength than a untrained individual. Next is build. A person with big muscles and well-built person will have more strength than an underbuilt person. Next is handedness. If you apply resistance on the dominant side, it will have more strength compared to the non-dominant side. And the last one is leverage. I explained you, if you apply the resistance in different place on both the limbs, if both the limbs are normal, and if you apply resistance on right here in one testing and you apply resistance here on this testing, then you will think that the left side takes less resistance than the right side. But the issue is the point of resistance. The places are different, so you will have to apply different resistance on both the sides. So make sure you apply the resistance on the same place on both the limbs. Okay. The next principle of MMT is documentation. It is a must thing to be done. It helps in knowing the condition of the patient, to plan the treatment, and to check what progress has the patient made in the future. Okay, what all things you have to note while documenting an MMT? These are the date of examination, the site of resistance, the patient position, and the site of examination. So one such example is given right here. So here we have mentioned the date of examination, that is 13/7/25, and then I am checking the shoulder flexors and extensors. Okay, so the left side, right side, shoulder flexors and extensors, the muscles to be tested. The grades have been mentioned. The next is the resistance. Resistance is applied on the distal end of forearm in both cases. So we have to apply the same resistance on both sides. So the same position for both sides, and then the position of the patient. Here I have tested the patient in standing position. So I have mentioned standing. Okay. So this is how you document an MMT. Last principle of MMT is the actual test performance, which is done in two methods. The first one is test performance and the second one is test position. In test performance, the motion of the limb is carried out throughout its arc. Okay, so here we carry out a movement in a specified direction through a specified arc. For example, for flexion of shoulder joint, we ask the patient to do the entire shoulder flexion with resistance added. But in the test position, we ask the patient to reach a certain position and then we resist it there and ask the patient to maintain that position against the resistance. Okay, so the patient is placed in a position and asked to maintain it there against the resistance. This is time saving and also prevents strict movements from occurring. Okay, it is used in patients who do not understand commands and in children. The only disadvantage is that it cannot be graded less than 3. So 3 or more than 3 can be graded using this technique because we cannot use the gravity eliminated plane in this position. What are the grading methods for MMT? These are of two types. First one is the MRC or the Kendall scale, and the second one is Lovett scale. So what are the grading systems? So the first one is there is no visible or palpable contraction seen in the muscle. So you visually see or palpate the muscle while asking them to contract. If you don't see any contraction, then the grade according to MRC or Kendall scale is 0, while according to Lovett scale it is none or absent. Okay. Next is there is flickering contraction which is visible or palpable, and that is given the grade 1 in MRC scale and trace in the Lovett scale. The next is full range of motion in gravity eliminated plane. So basically you need to do the motion in gravity eliminated plane that is parallel to the ground. That is your gravity eliminated plane. Okay, that is given the grade 2 in MRC scale and poor in Lovett scale. The next one is full range of motion against gravity. So the resistance here is provided due to gravity and no resistance is given manually. That is given the grade 3 in MRC scale and fair in Lovett scale. The next one is full range of motion against gravity with half the resistance of that of the normal side. So when you do the test on the normal side, you get an idea of how much resistance the person can bear, means how much strength that person normally has. So while testing the abnormal side, that is the affected side, you get to know how much resistance that person is taking. You don't need to put half the resistance of the normal side first and then put full resistance of the normal side. You just need to apply the resistance as much that the person can complete the range, and then think, was the resistance same as that of the normal side, or was it half of what it was on the normal side? So that way you will get to differentiate between grade 4 of MRC scale and grade 5 of MRC scale. So in grade 4 it is half the resistance, and in grade 5 it is full resistance. Half resistance is known as good grade in the Lovett scale, while full resistance, that is basically the patient is normal. So that is given the grade normal according to the Lovett scale. This is how both the scales give the grading according to the resistance against which the person can perform. And one more point which you need to remember is that for small hand muscles, you cannot find the gravity eliminated plane as the movement is in multiplanar movement. Okay, so grade 2, that is full range of motion in gravity eliminated plane, is basically half the range if the person is able to do half the range in against gravity movement for small hand and feet muscles, then it is graded 2. While if we can do full range of motion against gravity, then it is graded 3. So this is one small note which you need to remember. So what all are the types of MMT? These are the group MMT and the individual MMT. In group MMT, all the muscles with same primary action are tested together. So let's take an example, elbow. Okay, the biceps brachii, the brachioradialis and the brachialis muscle all cause elbow flexion. Okay, so all of this together cause elbow flexion. So we resist the elbow flexion and ask the patient to do elbow flexion. Okay, that is your group MMT for elbow flexors. But individual MMT means each muscle is separately tested as per its isolated action. As we have talked earlier, the biceps brachii acts in supinated position the most. Okay, the principle is every muscle is a prime mover in a different position. So biceps brachii tested in supinated forearm, brachioradialis is tested in mid-prone forearm, and brachialis is tested in prone forearm. Okay, in this way you can isolate each muscle according to its position. Next we have the uses of MMT. These are to get the differential diagnosis of a condition. Okay, next is to know the prognosis of the disease. So to check if the patient has progressed after the strengthening protocols and all, to know that we use MMT. To locate the site of lesion, as we have discussed earlier, that MMT can be used to know the site of lesion, and according to the muscles affected we get to know the exact site of lesion. Next is planning of treatment protocol, if you need to give stimulation or strengthening. In our video of strengthening we have discussed that what all strengthening protocols we need to use at different grades. So grade 0 we need to do stimulation, grade 2 we need to do some isometric contraction, grade 2 we need to do movement in gravity eliminated plane using the suspension. Grade 3 we need to do movement against the gravity with some support. Grade 4 and grade 5 we need to do the strengthening protocols. So in detail I have discussed in our strengthening video. The link will be available in the description box. Okay. Next is to plan a surgical correction, that is tendon transplant. Okay. So while doing a tendon transplant, we need to check the MMT of that muscle. Okay, the strength of the muscle should be 4 or 5. If the strength is less than 4, that is 3 to 1, okay, it is believed that the muscle loses 1 grade of strength when it is transplanted. So if the grade is 3, and if we transplant that muscle, it becomes grade 2. Grade 2 is the movement is available only in the gravity eliminated plane. So the patient cannot function that muscle, that action against the gravity. So what is the use of that transplant? Okay. Therefore, the transplant needs to be done of grade 4 or 5 only. Next we have the use is it is done prior to EMG to know which muscles are maximally involved, and thus helps to choose the muscle to be sampled. So MMT is a manual muscle testing and EMG is electromyograph. Okay, so before doing an EMG, we need to test the muscles manually and then find which muscle is most affected, and then EMG can be performed on that specific muscle only. What are the advantages of using MMT? The first one is it is a simple method. So whatever the action of muscle is present, you need to resist it using your hand and stabilize the trick movements. Okay, there is no external device required, therefore it is inexpensive. You just need your hands and the use of gravity, and that's it. The resistance can be varied according to the patient. Unlike dumbbells and resistance band, where you cannot control the resistance in the entire range, but in MMT you can manually manipulate the resistance throughout the range according to the strength of the patient. The last one is it helps in diagnosis, prognosis and the treatment planning. As we have discussed in the uses, it is used for diagnosis, prognosis and the treatment planning for different conditions and different stages of that condition. The last topic for today's video is the disadvantages of MMT. There are quite a few disadvantages, which are it is very subjective and therefore inaccurate. So the accuracy of MMT depends on person to person. Okay, and proper documentation helps in reducing the error while performing an MMT. Okay. The next is experience, skill and knowledge of examiner makes a difference. So the knowledge, experience and the skill of an individual will make a difference. For example, two individuals performing an MMT. One may feel that the resistance applied on one side is a little less compared to the other side, while another examiner might feel that I am applying the same resistance on both the sides. Therefore, the skill and experience plays a major role for the accuracy of the MMT. The next disadvantage is that it is difficult in bulky patients. So, if the patient is obese or overweight compared to the strength, you have to perform the MMT. You cannot apply adequate resistance or you cannot apply adequate stabilization. In those conditions, it is difficult to measure MMT accurately. And for that same reason, you need to go work out and build your strength as a physiotherapist so that you can sustain your body in different positions and according to the patient. Okay. Next is it cannot be done in uncooperative or unconscious patient. So voluntary movement of the patient is a must to perform an MMT. Therefore, it is a disadvantage that it cannot be done in uncooperative and unconscious patients. In stiff joints, we need to perform the MMT in the available range of motion. For example, the shoulder flexion is restricted up to 90 degree. So you can move the shoulder of the affected side up to 90 degree only. But here you won't check the MMT on the normal side to 180 degree. No, If you are checking here up till 90 degree, the same you will check on the normal side. Okay. Next is, it is difficult if both sides are affected. So the basic rule of MMT is we compare the normal side with the affected side. But what if both the sides are affected? How will you compare it with the normal gradient? In that condition, you need to make a note on the weight of the person, the age of the person, the gender of the person, the activity, and all the factors we had discussed before in our video. So all these factors will help you identify how much strength should the person normally have, and then you can grade it according to that. Okay. So this was all about the theory aspect of MMT, and in the next video I will be showing you how MMT is performed on muscles according to the different joints. I will be covering each joint separately and the muscles which cause the movement of that joint. If you learned anything from this video, please do give it a like, and if you have any doubts regarding to this video, please do let me know in the comment section and share it with all your physiotherapy friends. And don't forget to subscribe to this channel because all this video take a lot of time and effort to create. And this is Ronak Chandak signing off.